and C. Okay, are we recording? Have we got a R in the top?
Yep.
Yep.
Brilliant.
Okay, good evening everybody and welcome to the fourth in the series of the webinar. We're just going to hang on a couple of minutes and we've got one or two more people coming in from the waiting room. Just bear with us. Okay, so I think we've hit 6 o'clock, so I think we'll make a start. So what I would just like to say is, welcome everybody. You'll notice that you've entered on mute. If you could just keep on mute during the presentations, that would be great, just to stop any background noise, so you'll be able to hear a little bit better. We will be recording this session, as you may have heard. Paul was talking about that earlier, and this will be available on the website next week. So if you want to tell anyone else about it or want to review anything, then it will be available from next week. Can we please ask that you ask any questions through the chat function? If you go to the bottom of the screen, you should see it's right in the middle. It's like a little speech bubble. If you tap on that, you can either ask me, the Haemophilia Society host, directly. I will be asking the questions, or you can post to everybody. But obviously if you do that, everybody will see what you're asking, which is not a problem. But if you want to do it anonymously, then just send it to me and I won't read your name out. But you know, feel free to ask whatever you want. It's a friendly environment. So please note, and you can see this at the bottom of the first screen, that these speakers are not medical professionals. They're volunteers, and thank you very much for your time for doing this for us. And they're talking about their personal perspectives and experiences only. So, you know, we won't be able to answer any clinical questions. And these really, it's just for advice if you go to your treatment centre. This session is really just to assist you in perhaps thinking about some of the questions you might want to ask your centre, or it may be perhaps just help you to think about what you might want to consider if you're thinking about changing your product. You know, we don't endorse any particular product. It's all really about patient choice. So, and that's what tonight is about. So I will now stop talking and I'm going to hand over to Josh Crombie, who's one of our youth ambassadors, who's going to start the evening. So over to you, Josh.
All right, hey everyone. I am Josh. This is my background. So I'm 22, just fresh out of uni, and my specific diagnosis is haemophilia A, severe with an inhibitor. I got my diagnosis at 1 year old, and from then I started using Nova 7 on demand until I was about 7 years old, at which point I was moved on to FEBA, 4,000 units daily, and that was given through a Hickman line that I had for about 13 years. The part of my bleeding history was that I developed that inhibitor after my first ever treatment, after I fell out a tree on a camping holiday, which wasn't the smartest move. From then, I've developed rheumatoid arthritis in both of my ankles and a right elbow, which is partially fused now. Emicizumab, I was having 50 to 60 bleeding episodes per year, mostly in the ankles, but there was the odd one that would be a wild card. And I live fairly far away from the nearest treatment centre, which for me is Newcastle. Move on. So before I went on to Emicizumab, the considerations that we made were that there would be no more need for needles or aseptic technique, which took up a lot of the morning routine that I had to do. I was consistently late because treatments would take much too long to do in one go, and I was a student, so I would wake up far too late to give myself time. This treatment was significantly longer lasting than FEBA, which would give me decent coverage for about 12 to 16 hours of a day. The ability to it gave me, or would give me, the ability to live without a Hickman line for the first time in a long time, which was my major reason for switching. That would lead to more independence. I was just going into my second year of uni when we were considering switching me to Hemlibra, and I'd really been fed up in my first because I just wasn't able to do the things my peers were doing. And it's not something a lot of people would have to think about, but I had a fairly small flat at uni, and FIBA takes up a lot of space with the treatment itself and the paraphernalia that it takes to treat it. There were boxes everywhere, and it would be allow me to be significantly more flexible with what I was doing. And because I had a fieldwork heavy course, that was quite important for me. So those were all the positive things that I was going to consider. And because I was going on, but with the negative considerations that I had to make were I was going on to it during its third phase of clinical trial, when there was still a little bit of up in the air about dosing and what to do in an emergency scenario, which gave a little bit of anxiety, but it was more than worth the risk to switch. That's all that for that slide. Yep. So from my experience of switching, a little bit of background to my experience with Emicizumab, or Hemlibra as I call it now. I was first told about it at the WFH in 2014 in Orlando, Florida, and where my clinicians were also attending, and we had all seen the presentation on the early proto-Emicizumab, and we thought it sounded pretty promising. Fast forward about 4 years, and a lot of work that they had to do to get themselves classified as a comprehensive care centre, which I'm forever grateful that they went through that work to do for the several people that wanted to try Emicizumab. We all went on to clinical trial, and I took to the treatment like a duck to water. It was significantly easier than my treatment. It was significantly more effective than my FIBA treatment, and I was seeing no reaction whatsoever. Before the week that I switched to Hemlibra, I had an ongoing ankle bleed, which was nothing new, but it was just a bit frustrating. And as soon as I had my first dose, within 2 days, the ankle bleed stopped. And as the slide said, that was my last bleed ever. Well, not ever, but until today. And I've been on Hemlibra for 2.5 years. So going from 50 to 60 bleeds a year to 0 over 2.5 is pretty good going. So this meant that I could have my Hickman line removed. Unfortunately, because it had been in for so long, there were several complications through the procedure, and a fairly severe staph infection entered my pectoral minor and then into my major, which required me to stay in hospital for a fairly long time, which was nothing to do with the treatment, but was just part of the transition. So after this, this doesn't sound particularly pleasant, but it is an important part of the process for me of switching. The bleeding that I was having in my chest was pretty dramatic and required a fair few transfusions to keep me healthy. Constantly packing it with dressings, and nothing was particularly working other than the occasional respite after an over 7 dose. But once I'd been bleeding for a week after the treatment, we had my, I think, 3rd dose of Hemlibra, and the bleeding stopped within 10 minutes. So that just kind of goes to show how much it worked for me personally. If it was more effective than Nova 7 at stopping fairly severe bleeding. After everything was done and I was clear to go home, I was sent with the first home supply of Hemlibra, and was actually somewhat macabrely looking forward to giving treatment and injecting myself, because it finally meant that I could be a normal student. Again, I didn't have to dedicate up to 2 hours to give myself a treatment of fever, because that was how long it was taking to treat towards the end of my Hickman line's life. I could finally live without the constant anxiety of when the next bleed was going to be, how I was going to deal with it, what plans it was going to disrupt, whether or not I would need to cancel my degree because I just couldn't make it to some of the fieldwork exercises. And it prevented me from exacerbating damage that was already being done to my ankles and other target joints. And like I said last time, I'm still bleed free, and I honestly could not be happier with Emicuzimab. So to summarise, after something of a trial by fire to Hemlibra, I watched it be more effective than any of my previous treatments or treatment regimes. I acknowledge that I am extremely lucky that my centre was so supportive and so ready to do the work that they needed to do to get us onto Hemlibra and to get us early access to that. And my primary reason for switching, as well as the Hickman line removal, was that fever just wasn't working for me anymore. I was still getting numerous bleeds a month. I was still getting pain. I was still getting pretty severe joint problems. And because of the inhibitor, I just had no other options. So Hemlibra was something of a leap of faith. And again, I'm very lucky that it paid off. That's all from me. That's the end of my slide. And thank you for listening. I'll hand you over to Paul now.
Thanks, Josh. Good evening, everybody. My name's Paul Sartain. I'm a current trustee of the Haemophilia Society. So a little bit like Josh, I'm just going to quickly run through some various backgrounds information. So currently age 53, but not for much longer. I wasn't diagnosed with severe haemophilia A until I was aged 3.5, and I spent 16 weeks in hospital in traction for a bleed in my right knee. So that's quite fond memories for me. Prior to starting on Emicizumab, I was on Advate and a relatively low dose of 1,000 units 3 times a week. Prior to 2019, I was on mainly on-demand treatment with an occasional mixture of targeted prophylaxis. Obviously, somebody of my age, then I certainly have quite a bit of osteoarthritis in my knees and elbows especially, but also my ankles. So consequently, my haemophilia joint health score is on the top end. Again, somebody of my age, then I've gone through all previous forms of treatment available. So cryoprecipitate up until the age of 11, blood-based factor VIII concentrates from 11 until 38. And then I finally went on to recombinant and the standard half-life in 2004. Unlike Josh, I have been exceptionally lucky in the fact that I've never ever had an inhibitor. However, I have had minor side effects over the years with all of the products and still do get something now if I'm not careful. Also, I have had occasional problems with vein access, but that is more of a case of being unable to hit the vein rather than veins collapsing. So again, I've been quite lucky from that point of view. Next slide, please, Scott. I thought it'd be worthwhile just to put it into context. A 40-year bleed period for me, which this graph shows. So along the bottom is age, from the age of 13 to 53. On the vertical is the number of days. And basically what it's showing is my average injection frequency rate over those 40 years. So the higher the peak, the less frequently I do an injection. So as you can see, mainly whilst I've been on a on-demand basis, I was having to do some kind of treatment between every 5 and 10 days. And approximately that represents about 2,200 injections, if I remember correctly. Next slide, please, Scott. Okay, so my considerations. Basically, from a positive point of view, a very exciting opportunity. Once I started to hear about this new drug, I thought, oh, brilliant. Certainly no more regular intravenous injections. And we all, I would suggest, go through phases where we have good times and bad times trying to hit a vein. But I was certainly beginning to get more bad times in 2019. So consequently, that started to affect my confidence a little bit every time I tried to do an injection. Age was a factor for me, and certainly, you know, looking forward to the future and in getting older. And the other main thing for me really is, obviously, you know, you're getting more money for your buck, basically, because the treatment has a longer lasting effect. On the negative side, but I wouldn't really call it negative, I would call it more of a slight concern. Treatment protocols in an emergency, because this is still a relatively new drug, and also the unknown long-term issues / side effects, but they are not showstoppers in any shape or form. Next slide, please, Scott. So my switching process in discussion with my haemophilia centre was very, very easy. It was exceptionally comprehensive, and they were very open and very honest. And, you know, even to the extent that they admitted themselves that this is going to be a learning curve for them, as they don't have many of their patients on Emicizumab. They provided me with a documented personalized treatment protocol for what to do in the event of a bleed and also an emergency, and also my regime. Now, my current regime is treating once every 2 weeks, and I started that in December 2019. So on reflection, in my experiences, well, really no regrets. I would say it's been one of the best things that's ever happened to me from a treatment point of view. It has been a big change, and this is the one that has taken me by surprise the most, because it's been emotional, behaviorally, and also mentally, my thoughts process, because I found I'm basically going from black to white thinking. And certainly the first few months, that was quite a challenge for me. Next slide, please, Scott. Interestingly, within my first 7 days of my loading injection, my very first loading injection, I felt different. I cannot tell you in any shape or form what I mean by that, but I just felt different. Also, my sister and a couple of other people commented that my eyes looked a lot brighter and less yellow, interestingly, and that continues to present. I did have 2 primary side effects, mainly for the first 4 months, because I'm now in, give or take, month 8, coming into month 9, but they reduced over time. They were initially tiredness, and the day after my first loading injection, I did feel as though I'd been hit by a train. And for anybody who's listening who has previously been treated with interferon for your hep C, it brought back some very strong memories, because that's what it felt like for me. But my second loading dose in onwards, then nowhere near the equivalent of that effect. And like I said, basically that has now reduced. My other side effect was a rash around the injection site and slightly itchy, but again, quite minor, and now I don't have any rash or any itchiness at all. My 3 and 6 month blood tests that you have to undertake were normal, if not very good. So for example, my clotting time has changed from approximately 2 times slower than normal to now being 1/3 faster than normal. So I've had a very, very good response to Emicizumab. Also, certainly my knees and elbows feel less stiff generally, and also after activity. And to give you an example, prior to lockdown, I was a bit of a gym bunny, so I would be going to the gym at least 5 days a week for probably about 5 hours in total. I've now done 5 hours of gym and 2 hours of swimming in the past 6 days, and I've had no effects whatsoever from stiffness or even tempting fate and potential bleeds. Consequently, after being 2 months on the treatment, I stopped my non-steroidal anti-inflammatory drug, which I'd been on for 10 years from 2009. Just didn't need it anymore. I have had 2 very minor bleeds, both in my left elbow. One happened very early on during my just after my loading phase, and one a few months ago. The first one was spontaneous, but I think there was a trigger. The second one was a minor trauma, but no factor VIII was required in any shape or form, and within a couple of days, everything was back to full normal range of motion. So that's a quick canter through my experiences. So I'll hand you over to Scott now.
Hi everyone, I'm Scott, I'm 28, I'm an ambassador for the Haemophilia Society. Just to give you a little bit of background into myself, I was diagnosed at 8 months old with severe haemophilia A. Mum, if you're watching and I got the mums wrong, I apologise. So I've been on Refacto daily prior to Hemlibra for as long as I can remember. I was taking 500 units a day. Fortunately for me, I never had any inhibitors. I did develop rheumatoid arthritis to my hands about 8 to 10 years ago, purely because the amount of bleeds that I took to my hands. Because I was treating daily, I did get to the point where, you know, vein access became very, very difficult. I've had collapsed veins, and it's just got to the point where some of them weren't having any of it. I was having on average, I'd say between 12 to 14 bleeds per year, which is not what you would expect from someone who's treating daily. And this was before I started to become more active. So if I get this right and move us to the next slide, I'll talk about my considerations when I heard about Hemlibra. My centre didn't really talk about this treatment. I suppose I also had the positive with being part of the society that I knew a lot more about these treatments that were coming out. So I could go to my centre and say that I wanted this. So as soon as I heard about Hemlibra, Emicuzimab, whichever way you call it, and I realised that it wasn't going to be intravenous, I was very, very excited to jump straight onto this treatment. So one of the positives was no more needle burden. And as I said before, that did cause me a lot of issues. There was times where I was late to work because I try and treat in the morning to give myself, you know, the best levels I could go throughout the day. And the fact that I would have, you know, something that would be longer lasting and give my veins a rest. And I was hoping to, you know, have more independence being on this treatment. The only negatives I have, and again, I wouldn't call them negatives, it was just more uncertainties because it is a very new treatment. The fact that it was unknown, aside from what we knew from the trials, I didn't know what I would need to do when I was in an emergency, or if, you know, if I had a bleed, if I just had no idea. And familiarity. So it took me a long time to get used to my treatment regime and to get comfortable with my injections to feel independent. So to then change that up, it did have me a little bit concerned. And again, that comes back to confidence. I was confident with the last one because I knew how to tailor it to suit me. Going into the unknown was, you know, it was a worry. So my experience moving to this treatment, my discussions with my centre, I say difficult, and that was purely because it's a new treatment. They didn't know as much about it, so they weren't obviously too keen to potentially offer the treatment. It was more me fighting to get onto the treatment. And they believed that my current regime was working, and my argument was because I was tailoring my current regime to allow me to do things that I wanted to do. For example, getting piercings, tattoos, doing top models, things like that. So they were a little bit hesitant. Once we had agreed to go on to this new treatment, I didn't get much information after that point in terms of what I should do, should I have a bleed, and in terms of training for the treatment. Didn't help that I moved after I'd done my loading doses, so I did put myself in a gap of unknown, but that's just, you know, the way things went. And I'll move you to the next slide. Computer's not playing the game now, there we go. So experience in switching. Like Paul, within the first 7 days, I did feel different, and I felt very positive. I felt hopeful that this is working. And I for the first time in 28 years of life, I was able to differentiate between muscle pain and having a bleed, because every time I'd been to the gym or I'd done something that exerted myself, if I had muscle pain, the bleed was very quick behind it, and I'd need more factor and it would set me back. So to actually discover that, and to ring someone, to ring my centre and be like, I think I've got a bleed, and they say, no, that's DOMS, you know, you've just worked out a little bit too much, was very, very refreshing. I have had a few side effects from the treatment, and it doesn't happen to anyone, but I've also had increased joint pain to joints that I've had bleeds in previously, and had a few migraines. And I have been told, and again, I'm not an expert, and I'm not a medical professional, but apparently it can affect a few people taking this treatment. The one thing that I didn't expect moving on to this was needle anxiety. I've been very confident in doing my previous treatment. It's just something, I know that if I was ever in a situation I could do it with my eyes closed, I'm just comfortable with sticking that needle in my vein and getting the job done. Even if they're not playing ball, I'll find a vein that will work. But doing the subcutaneous injection had a strange effect on me, and it reminded me of when I was sort of 8 to 10 years old, where I just didn't want to do my injection. It wasn't something I felt confident with or comfortable with, and that's something that I'm currently working with my centre to get around and find the best way that we can do so. I have had a few bleeds since starting the treatment, and I've had to take factor as well on top of it. But it's also been a very quick process. So I moved house, for example, and I was doing a lot of heavy lifting, and I took a bleed into my shoulder. And normally on the old regime, I'd just do a dose, I'd be good. But I had to ring the centre, and it was still the same as when I was on factor. Like, okay, treat with this amount of factor, and it should work. And within 24 hours, I was back to normal. So the only thing I can say on that is I felt a lack of independence, because if it was on my previous regime, I would know exactly how to treat. So having to call someone before I could treat, it did have an impact on how independent I felt with the treatment. However, saying that, I was actually at my centre yesterday talking about my concerns, and the response has been unreal to the fact that we're looking at how to change my treatment. And if I'm being more active, for example, I'm running the London Marathon whenever it happens at some point. So if you just want to give us a sponsor, that would be great. But we're looking at how my treatment is going to affect my lifestyle. So Hemlibra can work for me, but it might be a case of if I'm doing something that is going to overexert myself, we can tailor an extra dose of factor to allow me to do so. So we're still looking at ways to allow that freedom with this treatment. I don't think I have any more to say in terms of my experience, so I think we're going to open up to questions for everyone now.
Okay, well, thank you all three of you for giving your personal experience, and it's obvious that all three of you have different experiences, not only of what your considerations were when you were changing over, but actually your experiences of the information you had from centres and actually being on the products itself. So I'm going to, well, first of all, just somebody's asked me to explain that why we're saying Hemlibra and Emicuzimab. So yes, the product has two names. Hemlibra is the brand name, a bit like Anadin would be, I suppose. And Emicuzimab is the generic name. So all products have two names, and that's why you may find that they switch between the two names, but it's the same product effectively. So we've just got one question here. It says, how would you describe the mode of how would you describe the mode of action for Hemlibra? And sorry, pardon if I. What? Oh, okay. So how were you told about the mode of action of Hemlibra? I think this is when you went to your centres. And how was it explained to you? How it works differently from normal factor? Paul, did I go to you first on that one?
Yeah, by all means. I was quite lucky in a way because I also knew some information about it. But in simple terms, what they said to me was effectively it's bypassing the normal clotting mechanism, which is why so it's tricking your body into being able to form a clot, but following a slightly different path. So hence why in the event of an emergency, if somebody does a normal clotting test on you, then obviously it will still say that you're a severe haemophiliac. But that's how it was explained to me.
Go.
Yeah. To be fair, I learned that pretty much similar to what Paul was told, and I suppose they may have put it into layman terms for me in the same breath as factor 8 that I was taking before would only last in my system for so long. Taking Hemlibra, it was introduced into the body differently and almost had a different way around making you clot. If that makes sense, it was just, it didn't break down as quickly, and yeah, it just found another way to trick your body into creating that protein that you don't necessarily create.
Yeah, I'm the same as Paul. They just sat me down, explained the clinical side to it, then just said it essentially makes counterfeit factor 8, and I understood that a lot more than the medical side of it.
Yeah.
Okay, that's great. Actually, just I wanted to ask something. What advice would you give to somebody who's going in to discuss a change of product with their centre? I mean, what do you think people could do in advance?
I'd like to answer this if possible. Yeah. I think for me is to look at what you're getting from your current treatment, how many bleeds you're having, and are you having those bleeds because your treatment's not necessarily you're not on the right regime, and to look at the treatment that you're going on to. So it all comes down to what you're doing day to day. If you're not doing too much, what kind of cover do you need? If you're going out and you're playing football or rugby, or even if you're doing gardening, it's to look at what level of cover you want to get from this treatment. And unfortunately, it's not an exact science. It does take some trial and error, but it's to look at what you're looking to achieve and what that's going to help you. Because the one thing I found is the needle burden. Unfortunately, I thought it was a be all and end all for me switching treatments. It's not. So we're in a testing period to find out what works. So it's to look at what you actually want to do day to day and what you want your treatment to do for you.
Okay, thank you.
Josh, shall I go next?
Yeah, I don't really have anything to say on that, to be honest. So feel free.
Paul.
Okay. I suppose really this is the first time ever that I've had an option other than recombinant back in 2004, where I could have stayed on blood products, I presume. So I think, building on from what Scott has just said, really what you need to do is know really why you may wish to change. It's the first one. Obviously now with the internet, you can go off and search your own information as well, but there's also a danger in that. But certainly know the reasons why you want to change and what you want to get out of it. Because I would say it is a trial and error situation for any treatment regime you may wish to consider going on. So you have to be pretty certain of why you want to change, especially if you're very, very comfortable in your current regime.
Okay, thank you. Josh, I'm going to ask you this one first, actually. Somebody's asked him, how many bleeds per year would you deem a success on Hemlibra? I mean, what were your expectations, and has that come out in reality?
I mean, I was having a lot of bleeds. There was a lot of mild to moderate bleeds, so a fair few severes. So I wouldn't say I was putting a number on how many I was expecting to lose, but I was expecting to have fewer severe and moderate bleeds. Because I wasn't expecting a 100% reduction in bleeds. I'd have been happy with probably 80 to 90, but anything would have helped. So it kind of depends how. Because if you're looking going on to Hemlibra, it kind of depends how many bleeds you're having, how serious they are, what they stop you from doing, and whether or not your current treatment can work as prophylaxis for that. Because I don't remember thinking anything other than just get me off fever for Emmy.
Yeah, and I suppose your experience with having an inhibitor is much different from those people that haven't had one, so it's a very different thing. What about for you, Paul?
Good question. I've never really thought about it. The only simple, obvious one I can say now is that if I cut myself shaving, I don't have to give myself an injection. And I'm not the best shaver in the world either. So obviously, when I was on demand treatment, then, you know, if I look through my treatment records, I've got quite a few for shaving cuts. So that was actually quite funny the first time I cut myself shaving, and I was just like mesmerized looking at it because it just clotted within a couple of minutes. But I didn't have any real idea or thought from that point of view.
Scott, your answer to this one?
To be completely honest, and I'll agree with Paul on this one. I've noticed it when I've cut myself shaving or been washing the dishes and maybe cut my hand on a knife, and there's been no cause for panic. But when I looked at Hemlibra, I wasn't even thinking about bleeds. I wasn't thinking about how many I'd have. It was purely needle burden for me. That was my driving force to switch treatment. So even if I had the same amount of bleeds, but I was treating once a week or once fortnightly, that's what I was going to do.
Okay, thanks. I noticed somebody's asked a question here about having a root canal on Monday. Well, good luck with that. And I know you sort of asked a bit of a clinical question, so I don't think we can really give you an answer as to whether that's appropriate or not. I think you really need to go back to your centre and ask that question. We can't really answer that one here. Sorry about that. So any more questions out there? Nothing else is coming in at the moment. So, okay. So it looks like oh, hang on. No, we've got another one coming in. Question for Scott. Why did you remain on daily standard factor for so long? Did the centre discuss switching to an EHL instead?
No, my centre, they didn't consider switching me to an EHL until I suggested Hemlibra, to be completely honest. And they were under the view that my regime doing daily worked for me. And to a certain extent, it did. Whenever I was doing something more active, because I was on that and because the way that my half-life works, I tend to kind of process factor very, very quickly. It allowed me to then, if I was doing something more active, I could take another dose and give myself the cover. So because of that reason, they weren't up for changing the treatment. If it's not broke, don't kind of fix it, kind of thing.
Okay. Oh, there's actually somebody just entered the waiting room, a little bit late, but there you go. Somebody's asking about change. Hang on. Do you have any suggestions how your centre could support patients changing products? What else could they have done to help you?
Who's this one directed at?
Well, to anybody really.
I'll answer it.
Yeah, because your experience probably wasn't as good as the others.
I've had a very mixed reception from different centres, and I'm certainly not going to name them. I think the biggest thing with looking at any treatment and dealing with any centre is knowing. It's very important for you to know enough about the treatment you're considering changing. But it's also very important for them to know what you're looking to achieve and what you're wanting out of your treatment. So as long as you've got a centre that will look at what your day-to-day life is and why you're taking this treatment, and they can find a way to make your treatment work and support you doing that, then that's all you can hope for. But it's also, as bad as it sounds, also about educating yourself about the treatment you're looking at, because it can all sound amazing, and we are very fortunate that treatments that we have available to us as haemophiliacs now is much more than we had 20 years ago. But it's just make sure that they understand what you're looking to achieve from the treatment you're going to, and hoping that they will support you. And that's as much as I can say, to be fair.
No, that's fair enough. Paul, did you want to come in there?
Yes, please. I was quite lucky because my centre, have been very, very good to me since I switched to them 17 years ago now. So they've always been on the front foot from that point of view. But I think what it comes down to is us being empowered as patients, knowing what's going on out there, and then knowing what our potential options are. And possibly a controversial point, I would say age has a potential issue in this. So if you're somebody who's like my age, in your early 50s, I was brought up predominantly in the doctor knows best type of environment, and also where there was less options available for you. Like I said, I started on cryoprecipitate, factor VIII concentrate came along, I went on to it, then heat treated, and then recombinant. Whereas now with standard half-life, recombinant, extended half-life, Emicizumab, and now potentially gene therapy in a few years, I think it causes a lot more confusion for us, if you like, and a little bit of less control. So I would say try and empower yourself as much as you can by finding out what is currently available, and then confronting, having a chat with your doctors, and if necessary, confront them, because I took part in, as a patient rep on the quality review. So I'd done a couple of centres. One was a comprehensive care centre, one was a haemophilia centre. And certainly from talking to the patients of the haemophilia centre, they had not been offered any new product, i.e. extended half-life or even Emicuzimab. And if I remember correctly, I even had to explain what Emicuzimab was. Admittedly, some of these patient reps were my age, if not a little bit older. So I would say certainly empower yourself as much as you can to find out what is currently available. But it's not an easy task now, I would say.
That's true. So this is an interesting one. Oh, sorry, Josh, did you want to come in there?
Yeah, I was going to say, from the perspective of an inhibitor patient, I would say there are fewer options, and I just completely agree with what Paul was saying. However, I would say that especially with the confronting doctors, because as much as we will always support people who want to take charge and learn about what is available to them, it is not your job to understand what is up and coming treatments for patients. So if your doctor doesn't know what's coming up, ask them to get themselves educated, because as a patient, you shouldn't be telling your doctors what's coming in the pipeline.
No,
Okay, thank you.
I was just going to chuck something in there if that's all right.
Yeah.
No, I completely agree with Josh, and Paul worded exactly what I was trying to say, just much nicer. But you are right to a certain extent, Josh, that yes, you are going to the professionals to say everything, but as Paul said, we do need to be empowered as patients and know what is available to us. And don't need to know the ins and outs of it, but to be able to go to your consultation and say, look, I know this is available. How does that work? That's the way every patient should be able to feel going to their consultation.
100%. Sorry, I might have worded it badly. I mean, you should always be aware of what's available for you as a patient, but I've completely forgotten how to word it.
I know what you mean.
I'm glad you do, because I've completely lost my train of thought.
We've got you. It's all right.
You don't need to know all the clinical aspects of it, I suppose.
Yes,
Isn't it, Josh? Is
I
that,
don't-
yeah, they can translate it for you. So one really interesting one is come through saying, well, okay, so particularly those who've had really good experiences on Hemlibra and Emicizumab, would you consider gene therapy next, or do you think you'd be happy where you are? And we are going to be doing another session on that subject later on, but just as a little teaser, what's your initial thoughts?
Shall I go first?
Go on, Paul.
I was asked if I wished to be considered for the phase 1 trials back a few years ago, but personal circumstances meant it wasn't ideal time for me. Really good question. If you asked me this question when I was in my 20s or even possibly 30s, I would have been very, very keen to do it. Asking me in my 50s, I would say I'm less keen. Part of it is I would be losing part of my identity in a funny sort of way. Haemophilia has obviously had a big impact on my life in more ways than one, and in many ways has dictated part of my life, but I've also controlled it as much as I can, and I'm quite a stubborn person as well, which doesn't help. So to lose that part of me now would actually be quite a loss, if I'm honest, I think.
Okay, Josh, your opinion.
I'm just trying to find the question again. So
would you consider gene therapy?
Oh, no, to put it simply. For all the reasons that Paul has said, plus that added security of every week I still have to do a treatment, so I'm still reminded that I am treated and okay. If I went months without a treatment of any kind, I would start to think I'm more fragile than I was, but that mental block of thinking I'm more delicate than I am would really take its toll on me. So as far as I'm concerned, Hemlibra is what I would like to be on for until it stops working.
Okay, Scott, what about you?
To be fair, jumping off the back of what Paul was saying, when I found out a few years ago that gene therapy was a thing, this was before I was involved with the society and everything like that, I tried to get on it. And they weren't doing it at my centre, they were doing it on down south at the time. And I really tried to get on it. And when it came to the potential of actually going on to it, I backed out because I very much thought that I would be losing part of myself if I did not have haemophilia. If I was younger and it was something that was available, then yeah, it would have been a game changer. But I've just grown up with this. I very much define myself by having haemophilia, so it's not something that I would really go for now. And I know how to control my condition, so I'm happy with that.
Okay. A slightly different question, and I think this is about as you've grown and become more experienced with your haemophilia, and obviously you guys have all lived with this for a long time. There's a question about emergency protocol and ringing your centre or your doctor. Have you found that over the years, have you become more in control of your own therapy and how your body works and your treatment works, that you've actually phoned people less? Has that been a thing for you?
Can I jump on this one?
Sure.
If you don't mind. So for me, this is something I actually touched on talking about the switch in treatments. My previous treatment regime, treating daily, I'd be lucky if I rang my haemophilia centre once every 5 years, because I understood what I needed to do. If I had a bleed, I knew how much factor I would have to take on top of that to deal with that bleed. So yes, I did become more confident with that treatment, and like I said, I rang them when I was on Hemlibra for probably I wouldn't say it wasn't an extreme bleed at all, but because it was a new treatment and I was unsure. So yeah, you do become more confident with your treatment as time goes on, and the older you get, you know your body, you know what's a bleed, you know what's not, you know how to treat it. So it certainly comes with time. I'd like to think that everyone else here will agree with me on that one.
Yep, 100%.
Yeah, I think there's a slight distinction between an emergency and when you might need to consult your centre because a bleed's not clearing up. Again, touch wood, I've been exceptionally lucky and not had any real emergencies. But obviously over the years, I've certainly had to phone my centre because a bleed's not cleared up after X number of treatments. But I would say, certainly the older I have got, then I've become more and more aware of my body and what it is and is not capable of doing, if you like. And certainly, whilst being on demand based treatment on normal factor VIII products, I would still fall into the trap of sometimes finding it difficult to distinguish of what is osteoarthritis, stiffness / grumbling little bit of pain versus what actually is a bleed. And sometimes I didn't treat when I should have treated, and I treated when I shouldn't have treated. But that's all trial and error. And I certainly, towards the end of my on-demand phase, if you like, I was certainly able to identify that if I had some kind of arthritic soreness for a couple of days, that would then turn into a bleed into that particular joint if I wasn't careful. But I think it just comes trial and error and experience, really.
Okay.
I've one more thing to add. I think it's because ever since switching, I've only seen my centre once every 3 months, and that's the only contact I have with them, except for certain appointments that I wasn't expecting to have, like issues with dentistry or with just general GP practices, because I will still need them to guide me on that, because I don't know enough about that at the minute to be confident in my own knowledge to tell the dentist this is what I do and don't need.
Mm-hmm.
So it's for very specific circumstances I still need that communication with the centre.
Okay, great. So this is an interesting one. I'm going to start with Paul. Do you feel more empowered being on Hemlibra?
Yes. It's
Good
weird.
answer.
This goes back to one of my first slides where I said it's been a big change, emotionally, behaviourally, and mentally, thinking-wise. Yes, I mean, the easiest way I can describe that is I used to go to London quite a lot for work, at least once, twice a week, and then for other times as well. And I used to always take with me 1,000 units in case I had a spontaneous bleed. The first few months I was on Hemlibra earlier this year, going up to London, I still had to put my 1,000 units in my bag to take with me, even though I wasn't allowed to use it without phoning the hospital first. And the first time I'd done that or stayed away overnight, because that was basically the standard behavior I had, was scary. Now, 8 months down the line, I don't even give it a thought. So it's like a black to white situation for me, which I've not ever been in all of my life. So yeah, definitely empowered.
Excellent. Okay, thank you. Josh?
Again, yeah, I agree with Paul, because before I went on to Hemlibra, the world felt very small. There were a lot of jobs I couldn't do. There were a lot of places I couldn't go. There were lots of things that I knew I shouldn't do and wouldn't do because I was afraid to do them. But after going on to Hemlibra, not that much has changed for me in terms of what I do for a living or education, but the world just feels a lot bigger and brighter, and I know that I can do so many more things now because of it if I choose to, and that choice is and that independence is what I was hoping to get out of Hemlibra. So yeah, that's the ideal.
Lastly, Scott.
You picked me last. Controversially, I'm actually going to say no, but I do have reasons for so. So unlike the way that Paul and Josh went on to this treatment, I went on it for very sort of selfish reasons, just treatment to keep us going. But I went on purely for needle burden, where looking at everything in hindsight, my old treatment was potentially working, and I feel like I've been less empowered since being on this one. However, since having conversations and being on this treatment, because it's very new to everyone, it's very new to us, it's very new to the centres, and there's still a lot of ways to work out how to treat and how to deal with certain scenarios. Just having a consultation yesterday, I've left feel more empowered on this treatment than I ever have, because we're looking at ways in which if I do need to treat on top of what I'm taking for whatever activity I'm doing, I can do so without having to call my centre, and we can work out the right dosage to move forward. So I do think going forward with this treatment, I will be empowered by it, and it will make a difference. Purely needle burden alone and what I'm looking to achieve, it's just going to take a little bit of working to get there. So it certainly has a potential to do so. It's just working out the kinks with it now. And it's the same with going on to any treatment regime. It's working what works for you. So I'm excited.
Okay, great. Well, I think we're going to wrap it up there for questions now, because we're coming up to 7 o'clock. So that just leaves me to thank you so much for your time, to Paul, Josh and Scott for giving your time, thinking about this and putting together your slides, and a special thanks to Scott for coordinating this, because you've done a lot of work on it, so thank you very much. I do want to say that we will be holding other sessions on this on other products. So we're looking at doing a extended half-life versus a standard half-life one, and also we will be investigating people's opinions more so on gene therapy as well later in the year. So do look out for those. Next week there is one on the clinical reference group. Now this may sound dry, but this is really important, because these are the people who have a real role in improving services for people with bleeding disorders. They're involved in commissioning, their input into things like home delivery, service development, and currently they're looking at the peer review, the quality review as well. So the chair, John Hanley, and the lead commissioner, Will Horsley, have very kindly agreed to do a session for us. So if you can join us, it really will be very interesting, so please do. And the week after that, we will be doing one on back to school. We've got a new schools booklet out, and we've got a teacher and a paediatric nurse from Birmingham who's going to be talking to us about starting school or going back to school. So with that, I'd like to thank you all for joining us on this lovely summer's evening, and hopefully we'll see you in the next few weeks. Okay.
Brilliant.
Thanks all.
Thank you very much, folks. Cheers.
Thank you. Thank you.
Bye.
Bye.